Hi, my name is Jorge Ortiz, and this is my DFS video project on medical databases. Now, when I was researching this topic online, I didn't quite find a lot of useful information. So instead of using the not so useful stuff, I decided what better way to find out about medical databases than to ask a doctor. So accompanying me today is Dr. Jean Ortiz from Billings Clinic in Montana, or as I like to call her, Mom. Say hi, Mom.
Hi, guys.
Okay, so Mom, I'm going to ask you a couple questions regarding medical databases, and you just answer them the best you can.
Okay, that sounds good.
Okay, question one. What is EMR and the type of information it holds?
Well, an EMR stands for Electronic Medical Records. It is a computerized program database where we input all the information from our patients. So it works in different ways. Among them will be to gather all the demographics and all the patient information, their insurances, and their other doctors, all their labs or laboratories, as well as our notes from the office visit. So we'll have all that information from all the visits they've been coming.
Okay, so then what are some of the uses then of your EMR database?
Well, one of the most common uses would be to be able to populate the patient's diagnosis and all their previous office visits. But we also may be able to extrapolate information from the electronic medical record database, such as if we want to get information of how many patients have been seen in a particular range of time, or what type of diagnosis we've been seeing, or how many patients have been seen by a particular provider, or we can extrapolate information as specific as if a patient is supposed to have certain blood work and how often it's been done over the previous year. We're also able to compare how many patients have a particular diagnosis or what medications being used, or if a particular type of test that needs to be done, if it has been done in a particular time. So that database is able to give us all that information of all the patients that are being seen in our clinic, not only per provider, but per center.
Okay, so then it's like you use it then, and you can get all sorts of information from it to better help the patient.
Yes, to better improve medical care. The electronic medical record is the best advancement we've had over the past decade.
Okay, cool. Okay, so my last question for you are, I know that way back in the day, it wasn't always electronic. You used to have to keep all your medical records on paper. So what are some of the pros and cons of having an electronic database compared to back when you had to have them all on paper?
All right. Well, we started using, in my particular practice, electronic medical records in 2006. Before that, when we used paper records, the advantage that I find was that you had everything right there, so you could just flip through and find what you wanted without having to go into the computer. And if there was no electricity or if there was any problem with the computer, you had it right there. That was one of the main advantages. The greatest advantage of having electronic medical records is that you don't have to be looking, you don't have to have a medical room, medical records room, where you have a bunch of records and that you have to find, that you have to file. Now we're just able to input the patient name and we can do the search and you'll have the whole record right there at all times. It can be used by more than one person. Well, before, if one person had the record, then the person at the lab did not get the information. So now, multiple persons can be evaluating a particular parts of a chart, and it can be done at the same time. Another great advantage is to be able to extrapolate all this information. Well, before it was so time-consuming. Now, if we put the parameters, we can get all this information right away. Another advantage is that it's easier to maintain patient privacy, which is a very important thing, and we can have all sorts of safety measures in the electronic medical records so that information is not, it's only shared on a need-to-know basis, which protects a very important law called HIPAA. So that I think is the best advantage we have is right then and there.
Okay, well, thanks, Mom, for sharing your great doctor knowledge on the AMR medical database. It was a lot of really good information, and that, for at least me, painted a better picture of EMR itself and its uses, as well as the advantages of having it electronic-based compared to one having it paper.
Yes, absolutely. Well, I'm glad that it was helpful, and every bit of knowledge is always good.
All right, well, thanks, Mom. Okay, well, this concludes my video project on medical database, and I hope you guys learned something new. Again, special thanks to Dr. Jean Ortiz for allowing me to interview her. In case you missed it, I am Jorge Ortiz, and thanks for watching.